Good evening, everyone, and thank you for joining us. Nebraska has been fighting EMT and paramedic shortages in recent years.
And officials say the problem is worse when it comes to rural areas in the state. Channel 8's Veronica Barreto has more on this story. She joins us now here in the studio. Veronica?
Yes, officials say a paramedic's job can mean life or death for a patient, and they say something needs to be done to address the shortage in Nebraska. Nebraska is struggling with emergency medical services.
Everyone right now expects that if I call 911 that an ambulance is going to show up. And if we continue down the pathway that we are in our state, there may be situations where that just doesn't happen.
Hansen says over the last 20 years, there has been a downtrend of people volunteering for EMS positions. But he says it has worsened in recent years.
Over the last 3 years, and with a lot of the added financial pressures that we're seeing because of inflation, those individuals that may otherwise want to volunteer, they're taking on second careers.
The crete-fire chief says volunteers have to go through difficult and time-consuming training requirements.
It is difficult to get people through that, and it's costly. It's $1,200 to $1,400 just to put a person through it.
Health officials and first responders say having these services available and in time, especially in rural areas, is crucial.
And it might take us longer to get out the door with the ambulance, which on certain medical calls, time is of the essence.
If we don't have those services, if we don't have those EMS professionals and the infrastructure available, we just may not be able to get to people.
And the state is hosting public meetings to talk about these emergency needs in our communities and get some input. There's one scheduled for our region in Beatrice at the Fire and Rescue Building. It will take place on October 18th at 7 p.m.
All right, good to know. Veronica Barreto, thank you for our top story tonight.